Dr. Drew, great to have you with us. Thanks for joining us here on the Great America Show. And we're hearing a lot from our audience about what is happening with the public health agencies. The information seems to be scattered. It seems to be disjointed, and we don't know to what agency or to what source or to turn for reliable information.
Yeah, Lou, you're making me sigh when you say that. I've been a physician for 40 years. My dad was a family practitioner. My uncle was a psychiatrist. I am deeply invested in this profession. My identity is tied up in it. My family, my father, myself, this job of taking care of patients, we've always thought was sacred and so important. We thought me and my peers, we thought we were doing something so terribly important. And that important part, a key feature of that was us putting the patient above all else, that the person in front of us was the absolute categorical priority and nothing else got in the way of that. Well, that relationship has been so severely adulterated and COVID just tore the scab off all this. I wasn't aware how bad it had gotten. I'd spent my whole career fighting insurance companies and all the things that adulterated my ability, the hospital administration, the utilization review nurses, things that adulterated my ability to deliver the best possible care for that given individual in front of me. And COVID showed me that we have lost. We've just lost. Physicians have become employees. They do not consider their job more important than their own health, which we always did. Sorry, but we did. That's why we, didn't sleep and committed ourselves to the patients above all else. It's why I got involved with the wellness company, because I began thinking that, we have to empower patients now, because the physician-patient relationship has been so encumbered. Now, in medicine generally, the more you superimpose anything on the most efficient unit, which is, sort of an Adam Smithian unit, which is the patient-physician unit, you add bureaucracy on top of that, you are ruining it, you're adulterating it, you're making things less effective, less efficient, and less quality for the patient themselves. So we have centralized things. We have made physicians employees. We have put public health in a position of authority that has never been postulated before. Lou, I had a nightly newscast on a local show, a local affiliate here in Los Angeles during COVID, and we were trying to help people kind of figure things out. And I was trying to get everybody to calm down. Panic never makes things better. Fear never makes things better. And the fact that the public health officials were using fear as a technique was astonishing to me. I actually thought it was the press doing it. So I blamed the press for it. It never occurred to me that the government and the public health officials would be duplicitous in all this. But of course they were, and we know now they were. But I got into a little bit of a tiff with my co-host, who's an excellent guy. And he goes, what does the FDA say about this? I said, I don't care what the FDA says. I taught medicine for a decade. Never once did these words come out of my mouth to the students I was training, the residents. What's the FDA say about this? No, never, ever. They determine what comes to market, not what we decide to do with those things in the marketplace that are in the best interest of our patient. So there's my little diatribe. Lou, I'm sorry, you pushed a button there that got me going. And you asked the question of who to trust, and you certainly can't trust centralized authority. That is a huge mistake. The best you can do is find caretakers that you believe you can trust, individual caretakers. It's always been that way. It will always be that way. You can trust us at the wellness company. We have, telehealth and that kind of thing. It's a very motivated group, try to help people that don't trust the general populace. But again, getting to the system is so encumbered. That's why people are, we have these, I keep going back to wellness. I'm excited about those guys. We have kits now that people can get very easily. Why should you wait weeks to go to a doctor that somebody you don't have a personal relationship with? Why should you spend $1,500 to walk into an urgent care center? It makes no sense. Our system is severely, severely broken.
It is. And you're talking about the wellness company and what they're making available to the public in the way of preparatory medicine, if I can call it that.
Yes.
It is, to me, it makes all the sense in the world. And to have a kit that's available with antibiotics, whatever
Yeah.
is, included there.
Yeah, yeah. You know how to use them. So what you're gonna these medicines have been around for decades. Humans, the adults know how to use them. You should have access to education, with physician backup through telehealth, and you should have access to these things at a reasonable price. It's most companies, a lot of countries have these things over the counter. You're on your own completely, but at least we're prescribing it, we're watching it, we're managing it, we're giving you access to physicians. It can be done, and it can be done very cost effectively. And some of them are sitting here right in front of me because I travel with the travel kit is a thing I set up myself, because I give my patients a group of medication when they travel. Right. I said, why shouldn't everybody have? I tell them what they need for what circumstance, and I give it to them should they need it. And oftentimes they do. And it shouldn't be incumbent on some healthcare system in Sri Lanka or wherever they're visiting. You're smiling.
Well, I'm smiling because we were at our place down in Florida a couple of weeks ago.
Yeah.
And I caught a cold. And there was my little blue kit. And Good. Luckily, I didn't have to resort to any of it because I'm just a powerhouse of immunity. I got lucky.
Good. You're right. No, that's right. And you should, you look, I could go on all day about this, but I've shifted. I've spent all these years taking care of sick people. And I really had I thought that, that I was too busy taking care of sick people. And now I've realized also we've sort of lost the battle on chronic illness too, because we are really ill in this country, psychiatrically and medically. And I'm sort of shifting my focus in my own older years back to wellness and, exercise and diet and taking care of your mental health and making meaning of life. This whole, the whole notion of happiness has become adulterated in this country. We don't even know what we're talking about or thinking about anymore.
I think you're exactly right. We're talking with Dr. Drew Pinsky, and we're going to talk some more. We're going to talk about your health, our health, and wellness. We'll be right back. Please stay with us.
Folks, did you know that over 90% of the pharmaceuticals in America are not made here? We saw during the China virus pandemic what happens when we are dependent on other countries like China and India for our most critical pharma needs. Recent clusters of respiratory illness have been popping up around the world, and in the United States, it's dominating the headlines. It's also shedding light on the need to be prepared for an unexpected medical emergency. Will you have what your family needs when the next crisis hits? Our good friends Dr. Peter McCullough and Dr. Drew Pinsky over at The Wellness Company have just what you need with The Wellness Company's medical emergency kits. These kits include 8 life-saving medications with drugs like amoxicillin, Z-Pak, and ivermectin, for you to keep on hand, along with the guidebook for safe use. From tick bites to COVID to extreme bioterror events, every scenario is covered. Go to twc.health/Dobbs and grab your medical emergency kit right now. Don't wait until you need it. Take control of your health today with the Wellness Company's medical emergency kits.
We're back now. We're talking with Dr. Drew Pinsky and talking about health in this country. And Dr. Drew saying point blank, what I think most of us are saying, at least amongst our friends, is that this country right now is not well. Mm-hmm. Mentally, so much of what is happening in our society, in my opinion, is directly attributable to pathology of some kind.
Yeah, for sure.
And I'm not smart enough to know what all of the illnesses are, but I do know this. We're watching a country in deep pain with deep troubles. Your thoughts?
Well, again, you pushed the right buttons for me. And so I'm going to sort of approach this from 2 angles. One is I wrote a book about narcissism back in the early 2000s, and I saw the narcissistic turn happening. I was talking to people on radio every night, and every caller had been injured during childhood by a destroyed family system, by drug-addicted parents, sexual abuse, physical abuse, and neglect. It was neglect. It was just clearly that was a pandemic at the time. And I was working in a psychiatric hospital at the time as well, and I watched the diagnostic sort of scatter go from a variety of different personality disorders to one and only one represented on all the diagnostic sheets. Initially, it was borderline personality disorder, and then it was ultimately the cluster B or the narcissistic disorders. You never saw anything else. So we clearly had a turn towards narcissism, which is a well-established outcome of childhood trauma. So there we go. And in my book on narcissism, I wanted to write about other periods of history where this had happened. And the most clear example I could find was pre-revolutionary France. And I thought, well, there's going to be guillotines and there's going to be mobs. And I wanted to write a chapter about it. My editor said it was too speculative. And social media didn't exist yet. The term cancellation hadn't been invented yet. But that is your mob, social media mobs, and your guillotine is cancellation. That is it. And if those of you that delight in putting people, go ahead.
I have to say, that is funny as can be to me. And I'm applauding as I say that, because it also seems so apt.
Right. It's true, right? It rings true. And here's the other thing that's true for those of you that delight in putting people up on the guillotine. Study your history, because the one thing about those sorts of mob actions that is inevitable in all historical contexts is if you put somebody up on the guillotine, eventually you're going on the guillotine. First it was the Jacobins, then it was the Girondins, then it was the Sans-Culottes, and then it wasn't until a strongman came in and put a stop to all of it that this came to an end when Napoleon came in. But before that, each group put the next group up on the scaffolding. You stop it, everybody. You need to stop it. So that's one aspect of what's going on right now. The other aspect, I would argue, is a deficiency in an understanding of what makes humans happy and what makes life meaningful. We are meaning-making machines, and it is extremely important for us to be well, to make meaning. And we have lost that completely. And the fact is, when that is studied, it always shows up that important relationships are the key, and having having a skill and a wisdom that you can use to help other people, essentially. Being of service to your community, to people. It's what I thought I was doing as a physician. It's what we used to do. It's what made it so wonderful. We always had that. But now that has become we've become sort of box checkers on electronic medical records, and that ability to contribute meaningfully and making meaning the way these, in my profession, and certainly this is true a lot of places, it's more difficult to do so. And I would argue the enemy is bureaucracy. That is the enemy right now of happiness.
Bureaucracy, in what form? Were you talking about the post office? Or are we talking about the IRS? Are we
anything really that prevents us from creatively using our skills and wisdom to offer something to another human being, which is all the encumbrances of electronics and supervisors and on high regulations and structures to it. All that just makes us robots. It doesn't make us give the ability to serve other people. Now you can find other ways to do it for sure. It doesn't have to be with your job. You could find other ways to be of service and make meaning. But it turns out that humans they don't get the kind of nourishment they need from service unless they have a skill and a wisdom that they can offer to another person. That seems to be the most effective way. And look at Blue. You look at every epic poem and every sort of philosophical treatment. They always go to the same place, which is come home. Candide. Voltaire ends Candide with, what did you learn through all your word travels? I learned you should cultivate your own garden. Come back home, serve the people that are important to you, be in close, intimate contact with others and serve them. That's it. That's the human experience. And we do not know that in this country.
I think you're right. And I also think that it is I wouldn't have thought to call it wisdom, but I think that the rational citizen right now loses perspective often that his or her community is far more important than what the United Nations is saying about anything, irrespective of the subject. It's far more important than anything that the U.S. Congress or the U.S. Senate is saying, and I don't care what the subject is again, because that proximity and that control over your life begins with that garden of yours,
Yes.
and metaphorically as well as in actuality.
Yes.
And your neighborhood and your community, because there you have the greatest control over your life and benefiting others.
That's right. And unfortunately, social media has made it feel like all these bigger, far away forces are in our neighborhood because they're right here on the phone. But the reality is, look out your window and think about what actually affects your life. It is your local governments. It's the roads. It's the garbage. It's the police. It's the fire. It's the, it's the power the power and water services. Yeah, I was thinking that in Pasadena, we have wonderful services in all those areas. And so why do I worry about the next level? Alexis de Tocqueville, another French reference here, came to this country in the early 18th century. And he was actually looking at our so-called penitentiary system at the time, but he ended up writing a very famous book on political science called Democracy in America. He wanted to understand why democracy worked in America. And his ultimate conclusion was it was local practice of democracy and the regular practice of democracy that resulted in its efficacy at higher levels. So it is incumbent on all of us to do that local practice, be involved in the local practice of democracy.
And we preach that quite often here on this show because we really not only intend that we're going to take back this country on November 5th, but that we want the country to be solid and sustainable and to amount to something once again. Some people call it making America great again. I just call it, long live the Republic. We were talking with Dr. Drew Pinsky, and I am having more fun talking with you and listening to your thoughts, and I appreciate it. I get to say something too that I don't often get to say on this podcast. Go to twc.health/promo code Dobbs. I love that. When I say promo code Dobbs, that means something to me. I'm not sure always what, but I love it.
Well, it's a good place to put your promo code. These guys, it's a great organization, really trying to make a difference. So put that promo code in there.
And I want to talk a lot more about the Wellness Company and what people can expect from them. We're talking with Drew Pinsky. We'll be right back, and there will be more promo code Dobbs, I assure you. Stay with us.
Folks, did you know that over 90% of the pharmaceuticals in America are not made here? We saw during the China virus pandemic what happens when we are dependent on other countries like China and India for our most critical pharma needs. Recent clusters of respiratory illness have been popping up around the world, and in the United States, it's dominating the headlines. It's also shedding light on the need to be prepared for an unexpected medical emergency. Will you have what your family needs when the next crisis hits? Our good friends Dr. Peter McCullough and Dr. Drew Pinsky over at the Wellness Company have just what you need with the Wellness Company's medical emergency kits. These kits include 8 life-saving medications with drugs like amoxicillin, Z-Pak, and ivermectin for you to keep on hand along with the guidebook for safe use. From tick bites to COVID to extreme bioterror events, every scenario is covered. Go to twc.health/Dobbs and grab your medical emergency kit right now. Don't wait until you need it. Take control of your health today with the Wellness Company's medical emergency kits.
So we're back with Dr. Drew Pinsky of the Wellness Company, and I want to start with where you were with mental illness in this country. You talked about childhood trauma as being a predicate or the cause of so much mental illness. Mm-hmm. But is it all? What we're watching is these are psychopaths out there in our public arena right now. Yeah. Behaving as they do, whether it's BLM or whether it is a border that is run by Mexican drug cartels, whatever it may be, there just seems to be just sheer madness here when a nation sort of puts down its hands and says, we won't guard our border, we won't protect our citizens, and so be it.
Yeah, it is hard to understand it, and there's many theories out there. I don't think that the structural issues you're talking about are mental illness. I also worry about being pejorative about the labels that I toss around. Sure. Look, if you want a good fighter pilot, you want a narcissist with a biological heritage of alcoholism, because those guys are good when they're in extreme circumstances, but you may not want them as your neighbor because that can be a little challenging. And so the terms have, they become problematic in certain circumstances. And I think the fact that the present circumstance is that narcissism isn't by itself a bad thing per se. Actually, the individuals with it suffer more than anybody. except that it has the liability of it is envy and empathic failure. And underlying narcissism, there's often a rage. So if you have envy and you don't really care about other people's feelings, well, now here it comes. And that's what mobs do. That's mobs sort of discharge that so they don't go at each other. That's how mobs work. And so I worry about envy. I worry about cultivating envy. I worry about people making some people, objects of envy. It's look at every religion on earth. They always have injunctions against the human emotion of envy because it is so destructive. So we have to do something about containing that. That's what when you're saying, what's going on out there, that's what you're looking at is essentially narcissistic rage getting acted out. And it only responds to containment. So it really is important to us. Everybody feels better when they're contained and they're not out of control with these emotions. So to bring, I look at the homeless situation here, drives me out of my mind because these are my patients on the street. These are people my patients untreated in relapse end up on the street very quickly. It's where they go. And you're not allowed to go near them and do anything to help them in the state of California. And they're dying in LA County at literally 8 a day. They're running open air hospitals without doctors and nurses. 8 people are dying a day. That is negligent manslaughter. And of course, because of qualified immunity, you can't say anything to these people. That's the kind of thing that is out of control. There are well-meaning policies and things in place that prevent us from doing things to actually help people. And that's where things are upside down right now.
As I listen to you, I think of an irony in what you're saying, because we began by talking about bureaucracy as a principal causal agent of this, and then we've gone and we've played it defining it.
Yeah.
But the bureaucracy reasserts itself in exactly the form that you're talking about. You can't reach out to these people because there are rules, there are laws, there is bureaucracy. And we have in the state of California, for example, in state of New York and most major states in the country, mindless bureaucracy built on mindless bureaucracy.
Yeah.
And what you're really describing is a closed feedback loop that is eternal if we don't break out.
That's right. And now go back to COVID, right? So all kinds of terrible policies were perpetrated on the public without any concern for the risk reward of those policies. I was screaming about it right at the beginning. It was extremely obvious to me that there would be mental health consequences. And I kept saying, look, you're 9 to 16 years old, you're 8 to 14, and somebody says to you, shelter in place, like our mayor did every night. And if you don't shelter in place, you're going to kill your family. And in the meantime, what you need to be okay as a 12-year-old is contact with your peers. No, we can't give you that. And we're going to pull you out of school so you can't have any cognitive development either. That is disgusting, and it's clear that would result in the mental health consequences, and here it comes, and now it's on, and we're accumulating more and more data about that. The point being, at no point does the bureaucracy stand up and go, we made a mistake. We really thought we were doing the best thing, but we made a big mistake. Sorry, we didn't intend this. Never. And changing direction was impossible. That's the other part about bureaucracy. They can't change direction. And now when we're talking about health and people's well-being, the worst.
Yeah, it's truly, as I reflect on what you're saying here today, I'm thinking you're talking about you don't want to have any pejorative around mental, quote unquote, mental illness, whatever the term would be. But you know what? There is a pejorative about disease because it is attacking the body. There is a pejorative about mental illness because it's attacking the mind. And I think we're all, I guess I resist the implied condescension of the medical community when they talk about, well, we don't want to have pejoratives. Well, you know what? We're talking pejoratives, and we're talking about adult behavior. We're talking about context and not just simply relativism, but absolute concepts that have to be, I think, it doesn't have to be put before us on a velvet pillow.
Yeah.
We can talk
Yeah.
straight about it. And I think that's what we've lost an ability to do in this society.
Yes.
It's
No,
one
you
of the
can't.
things that I believe that is a part of
No,
that mental illness, a
no,
bureaucracy of the mind, if you will.
you're right. I mean, you can judge. And you should be at your liberty to do so when people engage in destructive behaviors. It's not right to say you cannot judge, but being judgmental, you sort of get into philosophical zones with that, not medical. The kinds of judgment issues, that I always brought to bear for patients was, if you don't do what I tell you and you end up breaking the law, that's on you. That's it. You've now broken the law. It's out of my hands, and there will be consequences. And those consequences should be delivered with force, period. Number one. Number two, you may not be responsible for your illness, or maybe you had some duplicity in it, and you got to look at that. You got to own that. But you are responsible for your treatment. You are responsible for your recovery. And if you don't do that, then we can judge you.
Right. For example, we now know 300 people are dying every day of fentanyl overdoses. Mm-hmm. We have more people dying every year from fentanyl overdoses. Mm-hmm. Let me be clear, by about 30,000 per year more than died in the entire Vietnam War over a decade. Mm-hmm. And we are a nation oblivious to that death, that loss, that pain, that suffering. And we are inured to it by social media, legacy media. We're, in point of fact, averting our eyes. And frankly, I think it's one of our greatest failings as a country right now.
Oh, I completely agree with you. And you can imagine somebody like me. I'm like a surgeon who sees something I could correct lying on the streets all over the place, and I'm not allowed to go near them. You can understand this. We have this very strange relationship to brain diseases. If my brain disease is dementia, and I'm running around psychotic and disorganized, and I, as a physician, do not treat that individual, I am guilty of patient abuse. If those exact same symptom complexes are caused by schizophrenia, I'm not allowed to treat that patient unless he or she says, I want help, which is insane. Yeah. Part of the brain diseases affects insight. There's something called anosognosia, which is actually a biological block of insight into what the brain diseases are doing to the individual. Schizophrenia, bipolar, dementia, and addiction. You lose the capacity to see what's happening. Your thinking becomes broken. We call it stinking thinking in the world of addiction treatment. And we have privileged anosognosia and disturbed thinking in the law above people like me's ability to go in and help somebody. That's pretty much of a mess. And it's protected by activists as sort of, who are you to say that these people aren't living their best life? It's disgusting. And if I could hold them accountable for negligent manslaughter, I would. And then now we've got them all out on the street. We're serving them with social workers who are wonderful, but not trained medically to manage essentially what is an open air hospital. It's like asking a physical therapist to do orthopedic surgery. They're not trained to do that. And I gave a lecture to a group of county health officials, and they were all from all over the country, and they were like, oh, what do you mean? That was just how it was being done when I got the job. I said, okay, fine, it's not your fault. Stop it. Get doctors and nurses in there and start running this as a hospital that you're running outside there. If that's what you want to do, you want to run it outside, fine. But treat these patients.
Treat these patients. Yeah. The issues, the problems, the maladies, the diseases, all of the causes for so much friction and loss in our society, many and some not even discernible, but sufficient that we need good doctors like Dr. Drew Pinsky to bring our attention to to all of it in all forms. I just want to say, the wellness company can't take care of everything. And we've been talking about some of the issues that the wellness company, there's not a kit for a lot of things.
We're working on the mental health front. We're going to get there. I'm going to have some ideas on how to get at that too. So stand by.
I'm delighted to hear that. And I'm also delighted that the wellness company is putting together these kits that are preparatory for us to be ready to, in whatever the circumstance and emergency, and to, by the way, avoid the bureaucracies whenever we possibly can. TWC.health, the wellness company, .health/Dobbs, promo code Dobbs. I got to say it one more time. Dr. Drew, thanks a lot. I've really enjoyed our conversation. I know the audience has as well. Thanks so much for all that you're doing. And come back soon, please.
Good. There's a lot more for us to talk about. We're just getting started here.
There you go. Thanks so much.